Originally diagnosed in July of 2015 with clear cell ovarian cancer.
Holistic medication? What does that actually mean?
Holistic medication. Could I get a clarification on the definition of holistic medication?
Can you explain to me what that is?
So it's like better medicine?
I've been through so many doctors and how I wound up here was I was getting sick from food.
I had recently come back from Afghanistan with a major back injury. I was injured really bad, broke my back, was kind of partially paralyzed for a little bit, and was having a really hard time getting back on my feet. I don't take traditional medicines. I don't do what the doctors want to prescribe, morphine and oxycodone, and all these things are so bad for you and they're so addicting, I won't touch them.
I went to every specialist under the sun. I had CT scans, MRIs, x-rays. I had a nerve block at one point in time where they fried some of the main nerves in my back. That gave me relief for about 2 days.
This is the Genesis Center. This is the clinic that we opened 17 years ago. I'm a naturopathic physician. We practice holistic medicine here, and this is where we start the journey for our new patients, and then we'll continue to just walk through the office.
I'm Carla Rutledge. I'm a registered nurse. I've been a registered nurse for 38 years. I started out in conventional medicine. When I first became interested in alternative medicine, that was around 1995. And back then there was a huge stigma. I can remember I was working in the emergency room then and having arguments with the doctors, with the ER doctors. And they were friendly arguments. We were both laughing, but they were arguments. And he would say to me, you know what, none of this has been proven or tested. And I would tell him, just because it hasn't been tested doesn't mean it doesn't work. You know, it's not being tested because it's not funded. The cholesterol drug will completely wipe out your CoQ10 in your body. That's a supplement, you can get it over the counter, and CoQ10 that we have in us naturally depletes after the age of 40, so these people should be on it. It's imperative for your heart health and for your immune system. So these other patients that are being put on cholesterol medicines, they have zero CoQ10 in them, and some of the cardiologists will recommend taking it, and some will say that's just hogwash, you don't need it. Everything that we need, it's out there in the herbs and in the natural, in the food, the clean food, but there's just so many people that don't believe that.
The body is designed to heal itself, and if you give the body all the resources it needs, even at the cellular level, it will do what it naturally has been designed to do, which is heal. One point about holistic medicine, and that is that it's a natural approach to health and healing, but it integrates the body, soul, the body, mind, and spirit. And there's aspects to it that are considered very unconventional and controversial. And I just wanted to explain why that is a good thing. It's not necessarily a bad thing.
The success rate that we've had for simple things is great. We always find the root to even simple foods to eat and things like that. For cancer treatments that we've measured over the years, we have a stage 4 5-year survival rate of between 78 and 80%, and that's similar to clinics like mine across the country because we compile our data and we stay in touch with each other. It's been 15 years since I've lost a breast cancer patient. So a simple issue with cancer is that cancer grows in the body without the immune system being aware of it because it comes from our own genetics. So the future of all treatment is going to be to be able to make sure the immune system knows what to look for. And now we can actually program these immune cells called dendritic cells to be able to look for that tumor cell. My first patient that I gave it to was a terminal stage 4 metastatic colon cancer patient. So 4 weeks after we gave him his immune therapy, his tumor burden went down by 50%. And now it's been 8 weeks, it's down by about 75%.
Again, just reiterate, the body is made to heal itself. Just like if you get a cut on your hand, that heals. If you have a sick organ, that can heal. It just needs help. It's just like, you wouldn't keep opening up that sore in your hand. You would take care of it and, do what it needs to have to heal. And so you do that for your own body as well, depending on which cell and which organ it is that's sick. It's actually a lot less expensive to stay well through taking herbs and clean food and organic food than it is to go to the hospital and be admitted. So that is the main thing, that these supplements are a lot less expensive than medications today, and that they should be more available for people.
Key to holistic, care is sticking with it. A lot of people just expect a magical drug that'll get you through it in a week or so, and that's just not the case when you have a chronic illness. It doesn't work like that. Within 20 minutes, you had pretty much narrowed it down to Lyme disease. I've come a long way.
He helped me get back to phenomenal shape, and I'm getting ready to train for a triathlon. I never would have thought 2 years ago that I would be at the point that I am now, just because of holistic medicine.
It was funny because I ran across the Genesis Center once, and like everyone else, I dismissed it. I said, natural medicine, what's that going to do for me, But over time, all these doctors they wanted to prescribe me the pain pills. And I kept telling them, no, I'm not going to take them. I kept running across the Genesis Center. So I finally said, you know what? I'm at the end of my rope. I'm going to go give it a try. The Genesis Center started treating me. Lo and behold, they found the pain was not where I felt it, but it was actually over here in my rotator cuff. And they found it with their imaging. No other CT scan, MRI, any type of test you can imagine showed anything. And as soon as he found that, it started getting better, pretty quick. So I come back periodically, either because it acts up or just because, it needs a little extra treatment, it needs a little extra attention right now that I'm not giving it. And it's been the greatest thing.
So I feel like if there's a significant amount of data that it works, then insurance companies should definitely cover those too.
I prefer natural, because it just makes more sense instead of using all these pharmaceutical drugs. Because my aunt is a pharmacist, and she even tells our family, hey, maybe not do all the drugs at once because it's bad for you.
I think the more natural that we can be in our use of medication, the better our bodies are going to be.
If someone tells me it works and I see if there has been surveys and research being done and that it works, then it's fine with me.
Right.
I also think that kind of in the way that we use pharmaceuticals now, we use a kind of one-size-fits-all kind of approach, which I think if we have a wider toolkit to choose from, which would include a holistic medication style of those natural minerals and resources and things that I think we could, tailor each person's individual, medication style to best fit them, as opposed to, just prescribing everybody Adderall or prescribing everybody antibacterial medications. So
sounds better. So if it was cheaper, I would.
I think insurance should cover it. If it is proven to help and they can back that up, then I think insurance should cover it.
I think what insurance firms should most care about is getting their customers the best treatment that they possibly can, because in the long run for them it's going to save them medical costs anyways, and costs that they're going to have to pay.
I think it's important to know that there is other practices in medicine out there, and I think it's up to us to be proactive in finding them. And then once there is a demand to be covered and have these types of practices covered, I think we'll see not only more insurance providers and plans covering holistic medicine, but we'll see more holistic doctors popping up around Atlanta and maybe even Milledgeville.